easiest thing that a doctor looks at to figure out what's going on. I'm going to pass this paper, but I want to just try to get it back. If I can make some copies of you, I will. When you're looking at the tongue, the very tip of the tongue here, every part of the tongue is correlated to a certain part of the body, right? So ideally, when you look at your tongue, it should be in the morning. After you've brushed your teeth, you take out your tongue, you hold it out, and you see what it looks like. You want to see if there's any white or fur or moss. If you're not able to take that fur, if you scratch your tongue and it's still on there, you're having intestinal problems. Right here in the middle is, and most people, right here, it's white and it's just kind of pasty and blah, blah, blah. Here at the very tip has to do with your heart. Here on the side, it has to do with your lungs. A little further up has to do with your kidneys. So we look at that. We say, take out your tongue. We look at your tongue. We're like, oh my goodness. Something may not show up at all, but usually in the tongue you see everything. Don't check your tongue after you finish drinking some Kool-Aid because then your tongue is going to be red. You do it early in the morning. You take your tongue scraper, you brush your tongue, and then you kind of take a look at it. If you get into the habit of doing that, you can almost always tell when you're going to have a cold because your tongue starts getting, whatever it is. So I will pass this out, and you can look at it and just to see what section is correlated to your tongue. So when they look just to see if they have thrush, we look for a lot more. The tongue is my favorite part to look at along with the eyes because it's very telling.
So you're saying we should brush our tongue every time we brush our teeth?
Yes.
Or, okay.
Yeah. There's something that it's called a tongue scraper, and you take it and you scrape your tongue. I mean, I always didn't do this. I started doing this probably a couple of years ago. So every time you brush your teeth, scrape your tongue, and it's a good way to keep it healthy. For those of you that have partners, it's a nice way to do when you kiss. It feels a lot fresher, and it's a nice thing to do. It's a nice thing to do. But if you have like cracks on your tongue and they're very deep grooves, that means that the condition is a lot more chronic. She said that the dehydration, if your tongue is dry, you can tell you're dehydrated, so you're not getting enough fluids. So the tongue is like a miracle worker. If you get into the habit of looking at your tongue, you're way ahead of the curve, way ahead of the curve. This tongue here, if you see it, they call it I forgot what they call it, geographic tongue. And you see here, he may have, and it leans towards the one side, you see that deep groove, and he has all the thrush in the back. So he's having, they say that when doctors look at, it's not a big problem to us, we would look at this and I would see, my goodness, I would ask him if he's having back problems because of that deep crack there. This area back here, where is this area? Look, the kidney. Here is close to the heart, but not quite there. So I would see if other things in his body are coming up. What I see in the tongue, then I would be like, oh my God, let me see if it comes up somewhere else in his body. So, this is not what your tongue should look like. It should be pink. You shouldn't have any ridges. If you have ridges on this side, that means that you're not absorbing your nutrients. If your tongue, when you stick it out, it shakes a lot, you're having a lot of nervousness, maybe a lot of restlessness, that you're thinking about. So the tongue is very, very telling. A beautiful thing to look at. Yes?
Early signs of diabetes. You can if you have like what they call teeth marks
on the side.
Yeah, very.
Right. So take a look at your tongue when you go home. Here, when they look at your blood pressure, what is the normal, what's called the average blood pressure that you should aim for? What is it? 120/80. The doctor comes here and puts a blood pressure cuff on. 120/80 would be the ideal. I kind of disagree with that. I think that different cultural groups have different ranges that they can look at. My mentor said that in people that are African American descent, if their blood pressure is 120/80, you're pre-hypertensive. So that's way high for us. Ours needs to be a little bit lower. But again, going with traditional Chinese medicine, where you have the yin and the yang, the diastolic number, which is the top number, indicates the male side of your body, which is your left brain. So then if you're having that number that's way high, everything that's controlled by the left brain can be affected. And again, for the lower number, which represents the female component, is the right side of the brain. So if that's off balance, we can find out if you're not absorbing It'll also show up in your blood pressure. Are you having any infections, any emotional stress, any nerve deterioration? All that stuff we can see by your blood pressure, aside from it being, maybe too high or too low. Any questions? Any markings on your face, if you have any stuff that's coming up and you see that every couple of months it'll come up, it doesn't go away, depending on where the discoloration is on your face, it really says something about what's going on in a particular organ part in your body. So, again, it could be respiratory stress, it could be challenges in your intestines, it can be whatever. If it's here, wherever it is, we got to check it out and see if it shows up somewhere else. I don't know if this was a small one I tried. This is a big boil in the back of his neck. You see that pimple? And again, the same thing for your body. When you do an assessment with us, we ask you to take off your shirt. We just check to see if there's any hair growing out of places that shouldn't be going out, even if you've had it there forever. We need to know, and where it is correlates to a certain part of the body. Your lips, we want to know, we look at your lips. Are your lips cracked? If they're cracked, it can mean that you're dehydrated. Are they pale? It can mean that you're anemic. If there are any brown spots, it could be a sign of chronic indigestion. So the lips are also very telling, just like the tongue is. So we want to take a look at that just to see if everything is coming up in sync. Your hands and your nails, and I don't know if Freya would like to add to this. If you look at your nails, if you have any white spots on your nails, that means that you have a zinc deficiency. If you have any vertical, it's up and down. If you have any vertical lines, it can mean that you have pinworms or some type of intestinal worms if the lines are clearly visible. Also, if you have any possibility of any bacteria, we also look to see if your hands are cold, if they're warm, how flexible they are. We look at the little luna, it's a little moon underneath, and that can indicate, okay, we're supposed to have 4 in each one. One on the pinky. If you only have another thumb, there's a biggest chance that you will not count. If it's only on the thumb. And that's based on
What is without playing thumb?
You know the little moon is the little white part? Let me see if I see it. Esta lunita, Tú no tienes que tener los 4 dedos, si no nomás lo tienes en el dedo ese.
What if I have one all 5 fingers?
You have it here. Ask her. Or 5? Lo tienes así. If you have it on 5, you're going to have a heart problem.
Really?
Especially on your pinky.
It's a small one on my